Lori Winginter is a licensed independent mental health practitioner and a 20-year stage 3 colon cancer survivor. Wow. Lori quickly recognized the large unmet psychological need of cancer patients and set out to relieve that need. Lori works for a Nebraska cancer specialist and provides psycho-oncology therapy support to patients, caregivers, and families. Dr. Jane Kargis, Dr. Jane Kargis is a clinical psychologist who has been with Nebraska Cancer Specialists for 3 years. She earned her doctorate in clinical psychology. Dr. Kargis works with cancer patients, helping them navigate the complex journey of a cancer diagnosis. Thank you.
Great.
Okay. Yeah.
I don't think we need this,
Well, the reason
Oh,
for
for
the mic
the-
is to get it picked up on the record. Okay.
Is it on? It's on.
I believe so, yeah.
Thank you. I'm going to move over here instead of hiding behind the podium. It's so nice to see everybody today. I've done many of these, and it's such an honor every single time to come and just be with you and walk with you on this journey. And, applause to you, kudos to you for coming to this today. I was, I can't say fortunate enough, but it probably is. I did the very first conference that we ever did at A Time to Heal. It was a long time ago, and it was not this good. It was in a church basement, and I was just telling Jane, I think we just sang songs and ate cake and did some stuff like that. Kumbaya, yeah. But I participated every year. This is truly the best one. We have some really good presenters and some really good topics. So we're going to talk about mental health today, and I tried to make it a fun presentation, but we're presenting to professionals, we're presenting to caregivers and survivors. So I'm trying to just draw a line in there somewhere that will be helpful for everyone. And then I have a pile of questions that everybody emailed, and it's so impressive. I mean, we could do an afternoon talking about these questions. So I'm going to try to leave some time at the end to address some of those. But if you want to contribute something or ask a question during this presentation, please do that, because I really want to be interactive. Anything, Jane? No. Okay. All right. We'll like this first slide that's going to come up. I saw a patient gave me this graphic, and she said, Lori, this is what I feel like. I feel like I'm just running in circles. I don't know what to do. And everybody's head's going like this. So I thought it would be a good place to start talking today. Does this look familiar? Does it feel like you on some days? Yeah. Jane's flipping my slides. Okay, just for the continuing education credits, this is what we're going to do. We're going to talk about mental health and some of the most common diagnoses among cancer patients. We're going to look at what current research is telling us, and there's a lot of it. And then we're really going to explore interventions that will help improve your mental wellness. And then I have some resources at the end for you. All right, so traditionally when you get diagnosed with cancer, you start engaging in these therapies. So there's radiation, there's chemotherapy, sometimes surgery, sometimes immunotherapy. Often in the past when I've spoken, I like to say that, your medical treatment team will cut it out and burn it out and kind of go through all that, and then they say, okay, you're good, go live your life. And that's where everybody panics. That's where the anxiety hits, and everybody's heads are shaking. I don't know if you can see that. And I always felt like there was a missing piece. And that's kind of what I've tried to bring to the table. So the missing piece is that mental wellness, or the psychotherapy. So mental health is defined by the World Health Organization as a state of balance both within an individual and within your environment. And the balance includes all the parts of who we are. So your physical, psychological, social, cultural, spiritual, and all the other pieces that make you you. So in the professional world, we often refer to this, what we're talking about today is mind-body medicine. And I love this quote that says, mind-body medicine, this is the main area where miracles can occur. I've had many patients who have said to me, Lori, this is so important. I feel like this mental health therapy is just as important as my medical. And sometimes they say it's more important. So I always want to make sure it's a piece of the pie. Oh, anybody feel like this? Almost every time I have a new patient, they come in and tell the story, and then they say, do you think I'm crazy? Because they feel crazy. So brain fog or, fatigue or whatever else is going on. So they ask me, do you think I'm crazy? And I always say, no, because crazy is not an official diagnosis. But, next one, I do think that you're stressed. One more, Jane, sorry. So I wanted to mention, stress isn't an official diagnosis either, but boy, don't we feel stressed. And so I want to just talk about this for a minute because it isn't a real mental illness diagnosis, but it absolutely is a real state of being for us. So just briefly, I love this poor little girl over here with her head in her hands. Stress describes the effects of psychological and environmental factors on our well-being physically, emotionally, and mentally. Stress affects every system in our body, including the immune system, and there's so much research on that, the endocrine, and your gut health. And then disruptions of these functions can implicate a range of diseases in the body, including cancer. So I thought this was kind of fun. I came across this in my research. 2,000 years ago, the Greek physician Galen observed that depressed people were particularly prone to develop illnesses. In 1759, an English surgeon wrote that cancer went along with disasters of the mind, as occasion much trouble and grief. In 1846, British medical authorities considered the mental misery, sudden reverses of fortune, and habitual gloominess of temper constitute the most powerful cause of disease. So this is nothing new. We've known for a long time that there's a connection between mental health and physical health. But now we have a lot better research than, disasters of the mind. We have a better way to talk about it. But nothing in research permits us to state that psychic trauma can be the sole cause of disease. And so I just want to say that because, we all have whatever we have in our life. We may have some mental illness or some trauma, some abuse. It's not your fault. Cancer is never anyone's fault. And I have people ask me, did I cause this? And the answer is no, absolutely not. But there is a strong correlation between physical health or unhealth and mental health or unhealth. All right, anybody want to, I'm just rambling up here. Any thoughts, questions? All right, so we'll dive into cancer and mental health, where the two cross paths. Just a few statistics I thought were important. 35% of cancer patients also suffer from a mental illness. It can be a chronic mental illness that's been present throughout life. It can be an adjustment diagnosis related to cancer. I personally think this is a really low statistic. Because mental illnesses like depression and anxiety are very appropriate for when you're told you have cancer. Rates of major depressive disorder are 30% greater in cancer patients than in the general population, and anxiety is 20% greater, according to research. I still think that's those numbers are low. I mean, I guess they're based on individuals who have participated in studies and what's reported. And people, I found this statistic interesting. People who undergo surgery, chemotherapy, and radiation as part of their treatment, those three, have the highest rates of depression and anxiety. Okay, I'm going to come over here, just wake my legs up a little. So there really are two most common mental illnesses for cancer patients, and the first is depression that we talk about. So symptoms of depression include a loss of motivation, loss of interest in things that you formerly had interest in. It can manifest physically in aches in your joints and your muscles, headaches. Digestive problems are a huge indicator that there's a mental illness on board. Also, people who have depression have trouble concentrating or remembering information, making decisions, and sleep disruption. And that can mean sleeping too much or sleeping too little. But in depression, it's typically sleeping too much. But really, it's just an overall sense of a lowered existence. You can have something like major depressive disorder that we talked about on the last slide. And you can also have something, like we mentioned, adjustment disorder with depression. And that just means I'm feeling depressed as I adjust to this new diagnosis of cancer. So they're different, and we treat them a little differently, but the point is we want to treat them. And then anxiety is the most common, and probably if I had to just, based on my experience, I would say that anxiety typically presents first, because you remember, who's a survivor in this room? Okay, thank you for coming. The day, the phone call, the minute you were told you had cancer, what started happening? My heart's beating, it's hard to breathe. From there on, I'm feeling nervous, I'm feeling uncertain. There's a big fear of the unknown. I hear that all the time. That loss of control, a sense of panic. Panic is often characterized by a rapid heart rate, and like your heart's going to beat out of your chest. It might be difficult to breathe. Those are really panicky moments. But it can just be just a sense of nervousness. Again, sleep is affected. The GI problems is always a huge indicator of anxiety, because we know there's a direct correlation between the brain and the gut. And again, with anxiety, it can also be, adjustment disorder with anxiety versus generalized anxiety disorder. PTSD is an anxiety disorder, those kind of things. All right, Jane, just flip through those. So these are other common side effects. So we have guilt, sadness, loss of control, frustration, fatigue, brain fog's a huge one. Fear, there's a couple more in there. Insomnia, anger, and grief, and hopelessness. I think that's the last one, Jane. We didn't rehearse this. So does any of these look familiar? Yeah. And when you're diagnosed with cancer, you don't see all this coming. But this is all part of our mental wellness. I want to just speak for a minute about grief. No one really thinks about grief when they're talking about cancer, but Jane and I talk about this all the time. Grief doesn't exclusively mean death of someone, but it means loss. And when you're diagnosed with cancer, there are countless losses. And so it's important to process and heal all of that, just as you would heal your grief if someone died. The second stage of grief is anger. So it's okay to be angry. It's okay to feel depression. It's okay to be in some denial for a while. But our goal is to never allow you to be stuck there throughout your cancer journey. Okay. So I just had to throw this in there. Is mental health really that important? I love how your heads are all shaking. Uh-huh. One more, Jane. Yes! It's critical. It's the missing piece. So what can I do? I thought this was a cute graphic. And I wanted to share this next slide because it's something that I hear all the time. So raise your hand if someone's ever said to you, I'm so sorry you have cancer, but just stay positive. Yeah, right? Just be positive. And what do you want to do? Or worse, I'll keep it to this. You just want to smack them because you want to say, well, you be positive when you start chopping your body parts off, or you don't have your hair, or you're not nauseous every day. So I just wanted to validate that, as people mean well, but when someone says to you, just be positive, it's a hard thing to hear. But what I like to say is be optimistic. Because optimistic has positivity in there, but it allows for you to have a hard day or hard, week, or get up or go to bed just feeling beat up and I can't do this. That's okay. That's part of cancer, and you're allowed to feel that. But then the next day you get up and you feel optimistic again. So if you want to borrow that, go ahead. All right, so I want to move into, these are the really important parts of what can I do about it besides just being positive. These are tools that Jane and I talk about all the time in our practice. And there are hundreds, but I'm just listing the ones that are sort of most common or used the most that I see. So diaphragmatic breathing, you may have heard of this. It's called belly breathing sometimes. And does anyone use this in their day to kind of calm down? Yeah. Diaphragmatic breathing, it's a very biological thing. And I remember when I first started practicing, someone said to me, do you know how to do belly breathing? I'm like, yeah, I know how to do that. I didn't know how to do that. I just thought that was breathing. I know how to breathe. But it's a very specific technique. And the way that it works is that you inhale and completely fill your lungs so much that it drags your diaphragm down, which is lower part of your stomach or your lungs. And with the lungs so full and the diaphragm pulled down, it then activates the vagus nerve, which tells your brain then to settle down, calm down. So it's the air conditioning, the calming system of the body. And it's something that I encourage people to do. It only takes 2 or 3 minutes. And maybe if you start your day and end your day, kind of bookend your day with diaphragmatic breathing, you will find that you're calmer. So say if you have anxiety and you're living up here, this is the highest level out of 10. If we utilize diaphragmatic breathing throughout the day, we bring your anxiety down to here. So down at this level, I can absorb, whatever might happen that's hard. I have some space to absorb that. So diaphragmatic breathing is a lovely tool that can calm you, but also just maintain a lower level of stress or anxiety. And something you can do anywhere. I actually was doing it when I was driving here. Because, a little nervous, got to talk in front of people. I was working this morning and then had to drive over here and I'm like, Lori, just do what you're always talking about. So while I was driving, I did probably 4 deep breaths like that. And it helps. You can go online and learn more about this too. It's everywhere. But basically you want to inhale so fully that your belly comes out. And I hate demonstrating this because I have to stick my belly out, but I do. Progressive relaxation is something that I use a lot. It was first created in the 1920s by Dr. Edmondson, and basically it's a way to systematically go through the body piece by piece and just invite it to relax. And so I use this in my office. I have a lovely zero gravity chair, and I get some music and some lavender oil, and I read a script. But it's a very successful, helpful, and much studied tool. So try progressive relaxation. There's a lot about that on the internet too. And tying into that is guided imagery. So after I get my a patient's body relaxed, I'll then go into a guided imagery, which is tapping into the power of the mind and our senses. So I have lots of books that have good scripts, and we can use guided imagery to do so many things. We can use it to calm, we can use it to treat depression, we can use it to envision chemotherapy or my treatment going really well. So I'll say things like, now just imagine that you're through treatment and you're at that first checkup with your doctor, and see your doctor's face just light up with excitement because he or she is going to say to you, it worked. You're well. Cancer's gone. So imagining that helps tell your immune system, this is where we're going. So it's a really powerful tool. Has anyone ever tried this? Yeah. You find it helpful? Do you still use it?
I haven't used it in a while, but
Yeah.
it's in my toolbox.
It's in the toolbox. I know. A lot of these things I talk about, people will say, oh yeah, I used to do that. So hopefully we'll remind you to get back to it. Mindfulness is really just being aware of the present moment. So if I'm feeling anxious, I can calm my mind by just focusing on what's happening right now. So often that's, what are my feet doing? Well, I can kind of feel I'm leaning over to the right side, or oops, now I'm leaning on this beam or whatever this wall is. But by just focusing on something else, your brain can't go two places at one time. So if I'm focusing on what my body's experiencing, it can't continue to fire off to anxiety. Get adequate sleep. That's a really big one. Sleep is so important. And I've really been studying sleep because it really is the time where we restore our bodies and our minds and repair things that need repairing. So have you ever noticed you have a really hard day, or something happens during the day and you go to bed really angry? I'm going to take my sweater off. Anybody need a sweater? I'm hot.
It's hot.
It's hot in here when you're talking. So notice that when you go to bed, you're kind of upset and just ruminating about something. But then you wake up in the morning and you say, that's not so bad. That's what sleep does. It restores you. So never underestimate the value of sleep. And if you're having trouble sleeping, go ahead and get some help with that. There's some really good books and research on this. Finding joy in the little moments. This is a big one, because the thought often is, I'm fighting cancer, I'm going through treatment, how am I supposed to be happy? Well, it's so important to just not let cancer and treatment take your life from you. So during the really hard part, we have to find ways to kind of interject little moments of joy. And they're going to be, you know what makes you happy. For me, it's stepping outside in the morning and fresh air. It's petting my dogs when I get home. Just, feeling their fur behind their ears. Lavender is a thing for me. If I can just have a little lavender. I love a cup of tea in the afternoon with a cookie. Because you got to have a sweet with your tea. So think about what brings you joy and give energy and effort to that just as much as you do all the other stuff. And then lean on healthy relationships is another one, and Becky talked so brilliantly about that. I've known Becky for a number of years, and it's been a really hard journey. We just saw a little bit in there. But having solid people on your team is critical, because we can't do this alone, and we shouldn't. And so, I'm not gonna say anymore, because Becky really did a great job. Moving your body. There's a ton of research on exercise and wellness and fighting cancer. We're often asked, so Lori, what's the best exercise to do? My answer is the best exercise is the one that you will do. Isn't that clever? I know. Because people will say, I don't want to run a marathon, or I don't want to, climb a mountain. But you don't have to. And most research says that just moderate walking every day does the trick. There's some specific research, like more intense research 5 days a week helps reduce the risk of colon cancer. So there's some specific information in there. But basically, I want you to have a goal for yourself to get up and move your body every day. Some days are lighter, some days are more intense. Some days are based on the weather or whatever else we have going on, but move your body. Get fresh air every day. I loved that this one kind of came up a lot in the research, because I think we all realized during COVID how important getting outside and having fresh air was to our mental wellness. I mean, like, I would look at people in New York. My daughter lives in Denver, and it was really hard to go outside because there were so many people and so many rules, and I don't know, New York doesn't have a lot of outdoor space. But here we are. I think most of us in Omaha, there's plenty of outdoor space. Well, now we know the benefit of it and why it's so important. Some of the physical benefits of being outdoors is reducing hypertension or heart disease and a risk of stroke. It lowers your heart rate, and it decreases a risk of obesity, probably because you're moving your body. It increases cancer-fighting cells, so building that immune system. And we find improvement in diabetes. Mentally, the benefits. It decreases symptoms of anxiety and depression. It lowers cortisol levels, and we can measure this. So, if you ever go in for a physical, ask them to test your cortisol levels. And that will tell you where your stress level is. If it's really high, we got to do something to bring it down. Increased sense of well-being, suppression of negative thoughts. It helps immensely with sleep. I just learned recently that our eyes are receptors, and they talk to the brain. So if you go outside first thing in the morning and let your eyes see the sun coming up, or it doesn't have to be right when the sun's coming up, but that early morning sun sends a signal to your brain that about 16 hours from now we're going to go to sleep. So that's a tool that helps with sleep and mental wellness. It's fascinating, I know. And then being outside really just promotes an overall connectedness to the world and to each other. So find a way to go outside. Even if you're not feeling well, just go sit. If it's cold, put a coat on. Wrap up in a blankie. Just go out for a little while and let nature heal you. Nature is medicine. Nutrition. Oh boy, we could talk about this forever. Nutrition is so important. And I guess the bottom line there is that it matters what you eat. There's so much research on what kind of foods help us fight cancer, what kind of foods promote mental wellness. I have in the end here a book recommendation that talks about which foods fight specific mental illnesses. So, there are times where you can't eat well, or you can't eat, if you're going through treatment. And we're not talking about that. We just have to get through treatment. But when life gets rolling again and you have more energy, give a lot of attention to what you eat and your nutrition, and use that as a tool. Often nutrition can replace some medicines. So it's important, and a ton of information out there for you. Find ways to laugh. So Steph and Kay and I've been a part of A Time to Heal for 12 years or so, and I've sat on the board for 10 years, and we always say, we used to have a night where we would have everyone bring a joke or a video or something so that we could just all laugh, because cancer isn't happy. And so if we're living in that unhappiness all the time, our brains get stuck there, and our emotional health gets stuck there. So we can unsnap out of that and go, watch a funny dog video, or watch a funny cat video, or babies giggling. I mean, or even a funny movie, because that gets our brain moving a different direction. So find ways to laugh every day. Nurturing your spiritual self, this can be whatever you define it to be, but it's so important, I think, to have like a grounded spiritual sense. It can be church. It can be nature. I used to just, when I was first diagnosed, go sit by the creek and kind of, I don't know, let nature be my church. And so attend to your spiritual self, and you define what that looks like. Read and listen to inspiring stories of survivorship, and boy, we had a good one today. But there, if you need recommendations for that, for stories or books, there are countless ones, but Jane and I can sure give you some information on that, because I think it helps to, when you first start out on your cancer journey, or you're on your cancer journey, at any point, just to be able to look at someone who's living their best life on the other side of cancer and get inspired by that. And then the question is, well, how am I going to live my best life? Pet a dog. That was the last one I had to throw on there. This is my daughter and my dog. I had just a clip art of a dog walking a dog, and I said, no, I should put them in there, because that's my happy. So that's Winston and Macy. Okay, I'm going to stop there for 1 second. That was a lot, and I'm sorry. Anybody have any questions about those tools? Any comments, suggestions? It was a lot. Okay, well, if you do, just let me know. Oh, sorry.
I'll just share that.
Sure.
Tending to my mental health,
Uh-huh.
in my opinion, was more beneficial than my medical care.
Thank you. Yeah, I hear that all the time. And what's funny is, not funny, what's interesting is when I tell someone what I do, they say, oh yeah, that makes sense. Of course. And then I say, yeah, but it's not standard of care. You don't see it everywhere. And they're like, why? And, I don't know the answer, except that we just, we haven't identified it in the general public as an important piece. But it is once you utilize it and when you need it.
I had not tended to my mental health in
Yeah.
years.
Yeah.
So I had a long
Mm-hmm.
journey upward,
Yeah.
and I'm a better person for it, despite
Good for you.
cancer diagnosis.
Good for you. So did you utilize a lot of these tools? And yeah,
And I
still do.
it never far from my mind.
Yeah, yeah. Often, Jane and I, when I first started working at Nebraska Cancer Specialist 4 years ago, I was kind of surprised that cancer, you would assume that if someone's coming to see one of us, cancer is the most pressing issue. It's not. Often it's not. It most of the time isn't the most pressing issue. It's all the other life stuff that's happened. And so, it's our job to just kind of take all of that and help hold it and process it and then kind of move it on out so that we have space to put good stuff back in, like petting your dog and going outside, training your eyes. So thank you for sharing that. It is really important. It's the missing piece. And I think it's up to all of us, me especially, and Jane especially, to promote that and to, say this as often as we can.
I think when you're diagnosed, you actually should be paired up with someone.
Yeah.
I mean, that should, and even
Yeah.
though every week I was asked, certain questions, sometimes you don't know what you don't know. So
Right.
it, because you're really just in survival mode.
Yes.
So,
Yes. And those assessments are really good. They're, they're validated but I think in the cancer world, when you go in and you're asked the questions, are you feeling hopeless or helpless? You're just, I just need to get my treatment so I don't die. I mean, that's kind of the thought. So, often it takes someone like Jane and myself to really start to pick through it. And it isn't necessarily, like we've said, a mental illness, organic depression, but it's absolutely this adjustment to this terrible nightmare that's happening. And if you're someone who's never had depression or anxiety, you don't necessarily know what these symptoms are. I mean, I've had so many people say, well, isn't everybody anxious? They'll kind of describe how they're feeling or what their symptoms are. And I said, your anxiety is pretty high. We need to take care of that. Well, doesn't everybody live this way? And they don't. A lot of cancer patients do. But if you're having anxiety, that's low-hanging fruit. We can treat that. We don't have to suffer with that. And if we treat, say, anxiety and calm things down, you're better able to go through treatment. And we'll talk about some of that stuff. But yeah, I appreciate that. It's a hard one. So another tool that is available is to seek professional help. And I want to say at this point, everything I'm talking about and up until now and moving forward is available for caregivers as well. So it isn't just cancer patients. We're here for families as well. So when we talk about professional help, that's for everybody. And also, so counseling therapy. This needs to be a professionally licensed mental health professional. They come in different varieties. Jane is a psychologist. I'm a professional counselor, and then there's social workers. But you want someone who's credentialed, I think, if it's going to be professional. Sometimes in spiritual or in religious organizations, you might have someone too. And they can be very helpful, but and sometimes they're licensed and sometimes they're not. But just know that this is available to you. When you're doing counseling, we often refer that to as talk therapy. So, and that's what it is. But it's so much more than that. Jane and I like to jump in here anytime, say that our offices are safe spaces. And we really want everyone to come in and just dump it. Just dump what you're feeling. Get your tears out. Tell me how mad you are. Because there's something really magical about just telling someone all of that and expressing it, getting it out, because then that creates space, again, to put every good stuff back in. And so talk therapy, I've had naysayers who say, well, I don't know how talking can help. But it does, because it's expressing what you're feeling. But also, Jane and I, as we're talking with you, there's a lot going on in here. Like we're using our tools, and where should we take this? Which questions should we ask that will be helpful to promote healing and moving down the path? So we can also do things like art therapy sometimes in our sessions, the guided imagery, the progressive relaxation. There's lots of little tools that fall under the counseling. It isn't always talk, because there aren't always words to describe cancer, I think. If we need medication, we want to find it's best to find a psychiatric provider that can prescribe something for anxiety or depression. That's the gold standard, because they know those medications. Sometimes a general practitioner will prescribe. Sometimes your oncologist will do that. But if you're having depression or anxiety, let's help you with that. You don't have to suffer with that. All right, so the benefits. I wanted to title this slide The Anti-Cancer Mind, and that's taken from a book that's titled The Anti-Cancer Book, and it's in our list. But here's what it does for you. All of these things that we're talking about. Anybody interested in improving your symptoms of depression or calming anxiety, sense of control? How often do we feel out of control when we're going through the cancer journey? It's a big one. And so we need to find ways to regain some control. Improving cognitive functioning, and this kind of ties into brain fog. It can reduce pain. It can improve immunity and other healing responses that our body and our brain have. It can improve treatment compliance, and often research will say it may positively affect overall outcomes of treatment. So if I had cancer and I was going through treatment and I heard that statement, this may improve my outcome, I'm going to do it. And overall, it improves your quality of life. So I can still have cancer, I can still be going through treatment, and I can still have a high quality of life. That's what we're after right here. So this is a slide that I wanted to put in. It comes from a patient of mine who I have seen for several years for anxiety, so no cancer. Well, about a month ago, she was diagnosed with cancer. And, you know, it's hard. It's everything that we've all been through. But she came into session one day, and she's kind of telling me the hard stuff. And then she pulled out her notebook, and she said, Lori, I want to read to you. I've been thinking about all the gifts that cancer has given me. And I was like, oh, man, you're awesome. I mean, did you ever think you would say, cancer has given me gifts? And then she went on to read them all, and it was so powerful. So instead of having her brain stuck on all the bad stuff that's happening, she was able to list, it's improved my marriage. I'm so thankful I had you on my path already to help me with this. I understand now the importance of nutrition and, you know, just going through all those things. So there are gifts in cancer if we do that work and attend to our mental wellness. Same anti-cancer book. We can't avoid illness, but we can be better equipped to handle it. So this hour is all about the missing piece, the mental wellness. Another quote from a patient. I like these little stories. And when I hear them, I say, oh my gosh. A patient came in. I think she had metastatic cancer. First time I had seen her. She was very restless, a lot of anxiety. And she plopped down on my couch, and I always have a notebook, you know, or a notepad on the first session. And she said, okay, I'm just here because I have a few questions that I need answered. So I put my stuff aside. I said, okay, let's answer your questions. So she started talking about, well, we just moved to Omaha, and we have this house, and I have 3 kids, and all this stuff. And what it spun around to was, I have this new house, I haven't hung any pictures, I just need to know if I should plant my tulips. And she's so sweet. Like, she was so worked up about and paralyzed because she spun out of control, and it ended with, just tell me if I should plant my tulips. And then I said, I will if you take a breath, if you take a deep breath. And it was just such a sweet little transition in that hour, because what she was really saying to me is, should I get busy living or get busy dying? And so, you know, we talked a lot about that over the weeks. She ended up hanging pictures in her house and planting her tulips. But the concept behind that is my mental wellness is where it should be. I can plant my tulips, and I can lean into life. You know, I can lean into all the little joys, and you know, finding healthy relationships and all the things that we just talked about. So even though I have cancer, I can still live and plant my tulips. So you're going to remember this one. It's a good one. Okay, I'm going to stop there for a second. 15 minutes, maybe 12. I have some questions that, did you bring yours too? So, that have been emailed, and there's like 4 pages of questions. I wish we had more than an hour. Let's start with in here. Does anyone have a question they want to ask about your specific situation or family member?
I am a nurse. I work mainly in head and neck cancer.
Okay.
So my patients are men,
Mhm.
elderly, and I can't get them in your door.
Oh, yeah.
How do we do that? How do I get
Yeah.
just in your door? That's all I want. I have all these tools
Uh-huh.
to assess X, Y, and Z on whichever, if they're at a surgery visit,
Mm-hmm.
medical visit, whatever they're on, and you know, I'm fine.
Yeah, I don't need that
Yeah.
because I'm not crazy.
We've even done
Yeah.
study, like a prophylactic
Yeah.
Lexapro before they start treatment. I don't need that.
Yeah, I don't.
Yeah.
Yeah. Well, if they're older, part of that is probably that generation.
Yes.
Yeah.
That's what I see.
Post World War II. Yeah. And boy, we get that too. So, that's a toughie. Jane and I talk a lot about, jump in here too, that we can't force anyone to do this. We're not here to sell it. Well, kind of today I'm here to sell it. But I'm not, if someone doesn't want to be there, we don't want them to schedule because it won't go well. We're not here to force anything. But I think some things that you can say, just addressing like what we said, I know you're not crazy, but this is a tool that might be helpful. And lots of people do it. Another thing that if someone says, well, maybe, then maybe just try it one time and see how it feels. Because we never have people that don't come back. It always feels really good. I think other common misconceptions are that this is a sign of weakness. If I go see a therapist, something's wrong with me or I'm weak, I should be able to do this myself. That's not true. And, that's why I love that pie graph, because it should be part of the treatment automatically. So just validating that, this is a sign of strength to pick up the phone and make an appointment. And I say that to every new patient. I'm so glad you're here. I know this isn't easy, but you have a lot of courage for walking through the door. So, just validating that it's really good that you're here. You're doing a good thing for yourself.
I would echo what Lori says about if they absolutely don't want to come, it's not going to work. It's like
Yeah.
court ordered.
Yeah.
It never goes well. But, I find I have several men in my practice, and Lori's right. Once they get in the door and if they're able to express themselves at all, and a lot of men really aren't. They weren't ever taught the language of expressing emotion, and particularly older men. I think, younger generations of men coming up are have a higher emotional intelligence, but maybe you could say something like, I have other male patients who see Jane or Lori or whomever, and they've found it beneficial, but there is really not a lot you can do about that.
Thank you.
Unfortunately.
But with that said, if we get them in the door, we have lots of tools. Like I always say, I have my ways to get you to talk. And, really that's what's going on in our brains when we're talking to someone. But yeah, sometimes it just doesn't work. And so what I would say for anyone that's, professional in this room, that you can only do what you can do. You can only offer the service, and then it's up to them. And so, even if they still complain about stuff or, they're clearly anxious and depressed, at that point, it's just about validation. I know I can see this is really hard for you. I'm sorry you have to go through this. So, because we have a lot of our employees that want to try to fix it for patients, or even a caregiver trying to fix it for their person, we can't do that. It's really up to the treatment team to do that. But I can validate. This is hard to wake up and be nauseous every morning. This is hard to go through all these surgeries or have drains, lose your hair, all the negative side effects. So I think validation would come after. If he's still not going to do it, you tried, and you can maybe reintroduce it. But good question, yeah. Anybody else? Yes.
I just wanted to say that I've always been a strong person. I was a strong person in chemo, but I was in survival mode.
Mm-hmm.
And I thought, I'll never need to go see a counselor. But a lot of those things up there, I felt my life was spinning out of control.
Yeah.
And so somebody said, well, maybe you need to see a counselor, which I went and saw you. And I can't wait to go back. My next appointment.
Yeah.
Once I got through that door, I thought it was just
Mhm.
cancer that I was going to talk about, but very rarely
Mhm.
talk about it.
Mhm.
Things that were going on.
Yeah.
And I'm so appreciative of that you guys are out there.
Thank you for sharing that.
And
Yeah.
just a word about that. It's so common to have
Mhm.
patients that come in, and I know Lori touched on this, but everybody who gets diagnosed with cancer has a history. They have a story. They and things that have happened, sometimes really horrific things. And cancer is another one of those on the journey. So, and everyone comes in with, with how they've coped with whatever, and how their family, you know, what the family model for them too. So it really is about getting in the door, and I'm so glad that, you know, you made that decision, because it takes a lot of courage to come and make that appointment, so. But it's very often, I mean, it's
Most
not
often,
about cancer,
yeah.
but certainly, like Lori and I, it's so different than going to see a friend or a relative, because we don't know the story, but once the story starts to come out, then there are threads, you know, that can get woven from the past to the present, and how you're feeling about this, and loss and grief and all kinds of things, so.
And also that you're not being judged, or somebody will say, I don't understand what you're going through, just deal with it.
Well, yeah, I think a good point that we haven't mentioned is, you know, the anxiety is so strong, the panic hits after treatment ends. So the whole rest of the world thinks you're fine now because you finished treatment. That's the hardest point. And I think that's the most important or critical point for Jane and I to be on board, is at that time, because up until then, you know, our fists are up and we're fighting cancer, and I've got this whole team of professionals around me that are monitoring and treating me. But then someone says, you're done. Good for you. Go away now. Go live your life. And panic, right? Because no one knows how to live their life. What am I supposed to do? How do I know this won't come back? Fear of recurrence is huge. Symptom, I guess, that we talk about all the time. And you know, while we can't remove that, it's part of the journey. There's lots that we can do to ameliorate or reduce the negative effects of that. So I guess that's a good point, that the cancer journey is a long one. And once you step on it, you're always a cancer survivor. And everyone who raised their hand at the beginning, we're all on the same path. We're all cancer survivors. We're just in different places. And so I think that's important to know. There's a lot that needs to happen after active treatment. And of course, if you have something like metastatic cancer, then we have to talk about, how am I going to live with this chronic illness, which we can for a long time. Who else? Everybody's just got smiles on your face. I know you're tired too. Now it's hot in here. I want to read this one question, and then I'll stop. Someone said, as a caregiver, the last thing I want my patient to know about my anxiety, I don't want to lead on that I am busy or annoyed, but in reality I am. What are some good techniques about managing my anxiety to not lead on to my person that I'm struggling? And, you know, I go back to, again, everything we're talking about is for caregivers. But who's a caregiver in this room? We got some. You caregivers are hard people to crack because you know, the thought is, I'm good. I don't need anything. I just give it all to my person. But you do, and you deserve the same support. And so I think it's okay. Again, it's not a weakness to, you know, get some help for this. So, you know, whoever wrote this said, I don't want to dump it on my person, but that's why you come see us, or you do the other things that might be helpful. And that will help everything go more smoothly when everyone's taken care of.
And I would say to that as well, communicate.
Mm-hmm.
It's okay that if you're irritable or however, and frustrated and tired, you know, I think we have the sense that, like, the person with cancer or anybody who has an illness just can't handle that. And I just don't agree with that.
Yeah.
I really don't. I think it's so important to, I mean, you don't talk about it endlessly, but if you are short with the cancer patient, or irritable, or you lash out, just talk about, you know, I realize, you know, I'm dealing with my own stuff here.
Mm-hmm.
It's fine to just be honest
Mm-hmm.
about how you're feeling and how you're doing.
Yeah.
And I just don't think that is too much for a cancer patient to bear. Because it's just so understandable. It's just natural.
Yeah,
So
it doesn't happen to one person, we know.
It happens to the
It's,
family.
yeah. Becky was so right. It's hardest to be the caregiver. So if you're a caregiver, please take care of yourself. These are some reading materials that I wanted to offer. There's, countless books and things you can read, but these are ones that I pull out often and suggest for my patients. So there's a lot. The first two are kind of integrative oncology, just talking about all the things you can do to support yourself in addition to your medical treatment. The next book is how, as we mentioned, food can help or support your mental wellness. That's a new book. This author is a medical doctor and a breast cancer survivor and a foodie. So she kind of put it all together. It's really awesome. I always think, I should have done that. This is a new book that just came out. And she kind of she isn't a cancer survivor, if I remember right, but just kind of validating what we go through as cancer patients. And then there's a few more. Radical Remission addresses research surrounding metastatic cancer and the fact that people live a long time and they actually recover. And so this is all of these are based on research. This is the anti-cancer, anti-mind book that I refer to often. And then I had to throw some yoga in here for my friend Rhonda Weiss. she's an oncology nurse, an educator, but also a certified yoga instructor. And then and we're going to hand these out to you. We have some copies of these resources. It's really helpful to use some apps. It's so great. 20 years ago when I was being treated, none of this existed. But boy, it's sure nice. So to help with mental wellness and anxiety and depression and sleep, these are 3 apps that I find really helpful. I use the Calm app personally. It can help you do the diaphragmatic breathing too. But Insight Timer and Guided Mind are both really good. And if you can, subscribe to them because you get a lot more when you subscribe. And if someone ever says to you, what can I do for you? I want to do something for you. Say, buy me a subscription or buy me a book. And then some podcasts. There are lots of them out there. The Doctor's Pharmacy. This is Dr. Mark Hyman is a functional medicine doctor, but he talks a lot about nutrition and all the other non-pharmacological tools that you can use. And the Heal podcast has a lot of just general information about healing. And then we just found this one yesterday or the day before, Coping with the Fear of Recurrence podcast. So if you kind of search around in there, find what speaks to you. Find what feels like will be helpful for you. Sometimes something might not jive with you, but go find what will. And namaste. Thank you all.